Hi, my name is Henry Jones, CEO of Togetherall. Today, I'm really pleased to be leading a panel discussion on clinically moderated online peer support, where we will explore the applicability and perspectives from the employer, healthcare, and higher education sectors. I'm really pleased to be joined by Cecilia C., Dr. Alison Bickle, and Phil Evans. Cecilia is the wellbeing strategy leader at PwC US and Mexico and has over a decade of experience advising organizations of all sizes navigate change in complex transactions. Phil is in his 30th year at Protocol Services and has been CEO for 23 years. Protocol's currently partners with over 500 organizations, college counseling centers, community behavioral health agencies, and employee assistance programs to provide best-in-class call center solutions for crisis intervention and assessment, as well as self-guided digital mental health and wellness tools and a nationwide referral management tool with access to over 10,000 licensed providers for ongoing care. Protocol's partnership with Togetherall rounds out this continuum of care by bringing the benefits of their global network of an anonymous digital peer support to Protocol's clients. Phil has an MBA from the University of Oregon and lives on a houseboat with his wife and 3 children in Portland, Oregon. Alison is currently an independent consultant supporting public sector and not-for-profit organizations change and innovate. Previously, Alison was the Senior Program Officer for Addiction and Mental Health with Abelta Health Services, the single health authority in the province, responsible for public health delivery to over 4 million residents. She was also the former co-lead of the Addiction and Mental Health and the Maternal Newborn Child and Youth Strategic Clinical Networks in Alberta. I think you will all agree this is a pretty impressive panel. So thank you very much for joining us. So I thought I would start off with Cecilia, if that's all right. So I'm going to start off with you with the first question. And I think that the question I'd really like to ask you is about PwC's vision for supporting mental health of employees. And within that, maybe talk about some of the approaches and the things that you've done to achieve your vision, and what are some of the challenges around that?
Yeah, sure. So happy to be here, Henry. So thanks for having me. I think fundamentally, we all know that there are more demands on our time and attention than ever before. And this was the case even before the pretty major events we've all witnessed during the past couple of years. So at PwC, we believe that in order to succeed as an organization, we need to help empower our people, our organization's greatest asset, to embrace healthy behavior and prioritizing their well-being. Anything that helps us renew on a regular basis to help lower stress levels and improving how we just feel overall. And so with respect to mental health specifically, we try to remind our people that it should be no different to their physical health, and likewise should be prioritized no differently than their physical health. A phrase we like to say is that it's okay to not be okay, but it's important to talk about it. So we really encourage our people to have caring conversations, genuine caring conversations, foster psychological safety, so that people can feel safe and confident to ask for help and to identify when those around them may benefit from help. A few weeks ago, our firm's chairman just announced that we launched a new people experience strategy. It's called My Plus, which is a $2 billion investment in our people's well-being. And a big part of that is continuing our focus on prioritizing our people's mental health. So some specific examples is that we're doubling the number of free visits with a mental health professional from 6 a year to 12 a year, as well as increasing the reimbursement amount for out-of-network mental health support from 70% to 90%. Those are just 2 new examples of various things we've done to help reduce the stigma, to educate our people around what mental health is. I think the terminology can be quite loaded and have some preconceived notions, especially in today's world. But a range of things, from just encouraging people to feel safe to have the conversation, to identify when they themselves might benefit from help, from when those around them might benefit from help, and then adding on these benefits so that they have greater accessibility to expert help when they need it.
So just on that, so you've talked about, I think, a fantastic vision and a real focus and dollars really going behind it and real effort. What do you see as some of the real challenges in front of you of actually delivering on that vision? So some of the challenges you face, because it all sounds great, but we know it's very hard, if you see what I mean. So.
Right. Yes, it is hard, and I think as human beings, we know that change can be hard. I think many of us who have tried to adopt New Year's resolutions might find ourselves failing more often than not, despite our best intentions. And it can feel overwhelming to add yet another thing to our day, given that we all already feel so busy and overwhelmed. Even if you're told or you know that it's, quote unquote good for you. So really the challenge is reaching people and helping them stay accountable to themselves, to really value the importance of their well-being and see it as something that's not just an airy-fairy, nice to have when you have time, but really something that's critical to your progression in your professional career, but also in how you show up at home, in your community. So it's really reaching them and convincing them of the importance.
I think that's a really nice answer. I think I really would echo that, being able to get people to do it and giving them the space to do it, encouraging is one of the key challenges out there. So thank you. So Phil, I'm going to come to you now. So particularly with the education market, because I know you sort of cover sort of various different markets, but particularly with the education, when you're working with US higher education in particular, what are the goals and ambitions that you're seeing from the counselor centers that you're working in? And what are some of the best program initiatives that you put in place? And likewise, what are the challenges that you're seeing in that area?
Great. Thanks, Henry. And thanks to the entire Togetherall team for inviting me to be here. It's great to be here with the panelists. Togetherall has been such a tremendous partner for us in the higher ed market. So this is, it's great to be here. We've been serving the higher ed market since about 2004. And what we found at that point was the goals were really similar to what our mission of access has been all along. So I'd say the first challenge has always been access. And that's true for college counseling centers as well. And for us, it started with the 24/7 access. What do you do at 2 a.m. in the morning when a student is in crisis? What we've learned over time and deepening these relationships with our campus partners in higher ed over the last 15, 18 years, that those demands have only become more complex. Students are arriving on campus with increasingly complex needs. The demand has been increasing. And so we have partnerships with nearly 500 colleges and universities today. So it's been one of the areas where we've seen the greatest need. And so first challenge is supporting access to the brick and mortar resources that are already on campus. And as we've expanded over the years, we've used that basis, that crisis response, 24/7 availability, to look beyond that definition of access. What are the other ways in which students are accessing care, and how can we expand to meet those needs? And so that brought us into the digital app that we now have, the WellTrack app. We've acquired a off-campus counseling network. And that network, as you mentioned in the introduction, just this past week has achieved over 10,000 providers nationwide in our network. So again, those are about accessing care on your own through a digital self-help app, picking up the phone, calling us, or using the provider referral network to get connected with an ongoing therapist. all of these things wrapped around a single relationship with protocol. And that addresses what we found to be issues of, quite frankly, vendor fatigue. The number of providers that a campus counseling center director needs to contract with or build relationships with to meet these growing needs. By putting those under one roof, we've really supported our counseling centers in that way. And then the other real important need is helping to prevent students from falling between the cracks when you have multiple providers. And so what we've done is we've built these connections between these various services and these iterative levels of care that we're providing. And one of those very important connections and is our partnership with Togetherall. So fits right beautifully in that continuum of care, from the help that I can get by using my smartphone and working through exercises on my own, connecting with a peer who's probably been going through similar things through the digital peer network, picking up the phone and speaking with a counselor, or even scheduling an appointment with a counselor in my area, putting all that together in a seamless journey for the student, and one that can track that and make sure that we're not leaving students to fall between the cracks.
I think it's excellent. And I think we're seeing that a lot. And that actually, you know, as much as I think Cecilia and Phil, you work in what clearly very complex environments and very challenging, but brings me to Alison in the provincial health systems, where we're really talking about population health and stuff like that, where you are dealing, I think, you know, with very diverse populations and individuals who are often very hard to reach and don't have access to support and stuff like that. So in that vein, I think really interesting when you think about provincial healthcare, particularly around sort of mental health care and support and stuff like that. What are the goals that are foremost in your mind when you start thinking out the health system that's in place, and particularly how are you aiming to achieve those goals?
Mm-hmm. It's interesting to hear from everybody in terms of how supporting and improving mental health is showing up in everybody's systems, whether they're educational systems or workplace systems. So I come at it more from a provincial health system. So think all health services under one umbrella and organized by one kind of one ring to rule them all, if you will, one big bureaucracy, not different from the NHS in some regard. So with that, the overarching goal is how do we deliver high quality care at a sustainable cost? And right with that goal, you bump into some of the challenge. So relentless demands across like a broad spectrum of service complexity, you know, from mental health and addiction needs to cancer care, to an aging population, to chronic disease, to preconception. So you've got a huge complexity in terms of the kinds of services that you're delivering, lots of competing demands for resources. We are always dealing with the system that we design. So you both talked about kind of addressing gaps for patients and families on their mental illness or mental wellness journey. And some of how we've designed our system gets in the way of that. And I think we're always scrambling to try to address gaps, provide kind of comprehensive care across a patient journey, always navigating costs and roles and responsibilities, and a really high level of need for interdependency to support patients and families as they move across the system. And then the other thing that comes into play, irrespective of where you are, is kind of the level of politics that can come in and change direction, and 4-year election cycles and so on and so forth, that can cause a lot of turbulence in doing the right thing and staying focused on improving outcomes and care. So just a few things in terms of challenges and goals and what gets in the way.
It is a truly heroic effort to try, and as you say, in the UK, our experience of working with the NHS and working in that area is the complexity. It is hugely complex, and the politics and all of that make it a very challenging environment. What when you think about recent developments and how that's changed, what are the things that you think have really helped bring the ability to provide mental health services in a population model in a world like yours?
Yeah, I think so. Let's talk about Togetherall and why that kind of came to the fore in terms of how do we innovate at a population health level and provide care. And one of the things that always was at the heart of my work was working with patients and families and people who were recovering from depression, anxiety, addiction, schizophrenia, like the whole spectrum of mental health needs. And a real diversity of environments. So Alberta has 4.5 million people. We have very rural geographies and we have 2 major urban centers. So in different places, you have different services and capacity to meet those population health needs. And then I think from a health system perspective, really late to the game in terms of embracing e-mental health tools and technologies. So, a number of years ago, we started down this road to strengthen the integration of e-mental health tools and technologies to improve access and drive standards in care and accelerate adoption of leading practice and so on and so forth. So with that, we did a rigorous evidence review of there are some of the complexity in this space comes to thousands and thousands and thousands of e-mental health tools and apps. Some have good evidence that they actually have impact and are effective, and some have really great marketing. And those supported, many of the tools and technologies supported it's almost like a precision medicine model, if you will. But why we were attracted to Togetherall was partially about the technology and the scalability, but part of it was also there was a bit of a peer movement happening within Alberta, and that was led with a key partnership. Whenever you're talking about integrated systems, partnerships always become very important with the Canadian Mental Health Association, specifically Calgary branch, who had been working with the Canadian Mental Health Commission of Canada, who had really done a lot of stewarding of peer support and the peer movement across Canada. And what we heard in the stories from patients and families was the importance of peers in their recovery. We talk a lot about, increasing remuneration for professionals to support recovery, but having someone who has walked that journey and can walk with you in a non-judgmental, non-professional way, super liberating for people in recovery. And so, and because we're in healthcare, a lot of legitimacy is such a high bar. So, really understanding what does it take to be a strong peer, and what are the competencies around that, and what is your role in that recovery journey with that person. So Togetherall just gave us a really, a philosophically aligned platform, one. And the second thing is it aligned with the goals, high quality care in a sustainable model. And then the third thing, it really piggybacked on that peer movement that was perking more contextually, nationally in Canada and provincially as well. So I'll stop there.
I think that was excellent. I mean, thank you for that. But what is, I've just come back from the States actually, and I was saying to people that, what I have really, really noticed, and I remember being on a call with you, I think about 3 years ago when we were talking about peers right at the beginning, and you talked about CMHA talking about peers, but I think that is a notable movement that is happening across North America now, is this realization of the peers role. I think even the president talked about it in his State of the Union address. So I think that has been, actually, I think you were probably quite early to the table on that, and we're really seeing that movement really grow. So Phil, you know, I guess we've now sort of teared up, and I think Alice was really nice talking about peer support, but particularly how do you see that fitting into the student world? And you've talked a little bit about that, but also, and you've talked a bit about it, is, you know, how do you really see that fitting into the protocol offering and what you call sort of, I think, protocol plus and stuff like that? Because you've been a fantastic partner with us, and I think right from the earlier days we saw an amazing sort of synergy of what you do and what we do. So it'd be really interesting to hear about it from the student perspective.
Absolutely. And I really appreciate Alison's observations on the importance of the peer movement. Henry, Protocol had launched a peer-to-peer warm line of our own in 2015 or so, in response to that need for the voice of lived experience to be informing our work. And our peers and our professional counselors were in the call center, literally side by side, doing this work. So we've been informed by that history. And you bring in the increasing demands and need for scalability, which we've also talked about. And those two things, the importance of destigmatizing help seeking behavior, depathologizing it by creating these much broader mechanisms by which people can seek support and help. Having that exist only at the far end of a master's licensed level clinician practicing at the top of their license is extremely inaccessible, and it's not scalable, and it doesn't even begin to meet the need. And the increasing demand to provide support to college students informs the importance of that scalability, of creating that access to care in a way that is destigmatized and not pathologized. And I think you've got a age group population that is, very much primed to be able to interact digitally in a platform just like the one that Togetherall has built. And Togetherall in particular has been an incredible partner. And I learned very early on in working with the Togetherall team that one of the most important aspects of this global digital peer community is that it had to be at scale. It had to have enough depth and breadth in order to be credible. And Togetherall has been working on this for years. And when we began our partnership, it was very much teed up and ready to go in terms of the level of experience that Togetherall had and the number of relationships that Protocol already had with college campuses that were truly struggling to figure out how to enhance the support they provide to their students.
That's excellent. Thank you, Phil. And it has been, it has been a great partnership and a great fit. So thank you very much. So that brings me back to you, Cecilia. So, PwC, we're quite sort of early days in terms of our relationship and understanding. I guess what might be a really good place is, from the employee perspective and from PwC, particularly why Togetherall? How does it fit into your vision? What part do you see it playing in your ecosystem and your strategy? Because clearly you have a very well thought strategy. It from what you said right at the beginning, it seems like the leadership is fully behind it and fully vested in it. And I think, as Alison said, there are thousands of digital mental health businesses out there, some great, some with great marketing, but I think that was a good way of putting it. So why Togetherall for PwC in North America?
Yeah, I think we've seen firsthand how valuable peer support can be. And I know Alison and Phil, you talked a lot about that. But for us in the workplace, given the stigma associated with mental health, and I think even in North America compared to other parts of the world, just talking about mental health, like I said earlier, can feel very heavy and feel quite loaded. And oftentimes people will see the term mental health and feel that doesn't affect them. And so they automatically opt out. But notwithstanding that, we have found that when people come together and just realize that they aren't alone, just that itself is incredibly invaluable. So especially given that we have been missing the human connection, predominantly working from home or virtually, just being able to find comfort in knowing you aren't alone in however you're feeling, whether it be a mental health concern or not. What was attractive about Togetherall is that we continually look for impactful tools and resources to help support our people, providing access to them in a way that feels accessible to them. So if mental health feels heavy and feels loaded and feels like something that doesn't apply to them, that it's still something they can get value from. So what we did like about the look of Togetherall was that it was providing a safe space, another option for our people, safe in particular given the user anonymity, while still being productive in providing community and also being supported by licensed professionals. So it's really another way or another avenue to complement the various forms of community we already have within PwC, with the added benefit of the anonymity and the access to licensed clinicians.
Sorry, I was on mute. Thank you very much. It's a great answer, and we're very proud to be working with PwC. So I'm going to finish off with one question, which I think wasn't sort of on the question sheet, but so I would sort of get your sort of response to this. But one of the things I believe in passionately is, and you, Cecilia, you talked about the anonymity, and the other big issue we see is the accessibility, which Alison talked about, and Phil talked about the accessibility of students. But how does, we live in a world now where, for many, accessing mental health support services is not something that they would have done or however done, or they haven't had access because they haven't been able to get to a support center, or they don't have employee insurance, etc. So, for I think one of the things that I find we talk about as one of our charter goals is this idea of access to all. I'd be interested, as you think about your different populations, how that fitted into the way you think about Togetherall, because I think it's absolutely fundamental to who we are, and it's one of our 3 charter goals. So I'd be interested, if anyone has any thoughts on that, because I think that's something we haven't really talked about today, but I think is really, really important. And actually, I think is really important knowing each of you, or the organizations you work for, important in the way you think about how you deliver mental health care support. So whoever wants to go first, let me know. So I'll pick someone. Cecilia, do you want to talk a little bit about that? And then Alison, I'll come to you, and Phil, if you want to finish it off, that would be great.
Yeah, sure, Henry. I appreciate the prompt or the reminder of the emphasis on access to all, because maybe I haven't articulated it as clearly, but one of our challenges is to reach people, like I said, and embedded in that is convincing people that mental health is applicable to all.
Yeah.
Again, regardless of whether you personally feel like you may be struggling or not, anyone can benefit from good mental health hygiene, for a very technical term. So I think that access to all is something that we observed from early conversations with Togetherall, from demoing the platform, it doesn't feel too clinical. I think that's intentional by design. Knowing that there's licensed professionals on hand is helpful, but it doesn't feel, again, technical term, big and scary. It feels like you can come and you can just observe the conversation. You can come and raise any concern. It doesn't have to be what maybe mainstream media talks about when it talks about mental health, capital M, capital H. So I guess from that perspective, we're in the workplace working on, again, convincing people that mental health, well-being is applicable and can benefit all, regardless of what community you're from, regardless of what you may be experiencing in your life. So we prioritize options and choice, and Togetherall is one other option for you to opt in with no pressure.
Thank you. So Alison, I think that's really nicely said. And Alison, I think also, in a population healthcare model, or in your situation, there are a whole load of people who traditionally don't have access to support. And so I'd be interested in your sort of thoughts on that as well. Sort of final thoughts on that.
So I'll kind of go back to our thinking around trialing e-mental health tools and technologies as part of the recovery continuum. And we came at this from two angles. One was measurement-based mental health care delivery as part of an integrated care approach. So where as a youth, anybody, adult, whatever, seeking addiction and mental health treatment, you're connected with a clinician, you get an objective assessment that help us understand in a measurement way, in an objective-based way, whether the kinds of care you're getting are improving your individual outcomes. So that was, and that there is a suite of e-mental health apps, tools, CBT, whatever, there's a whole host that would be connected to your individualized care plan. So that is one way of coming at the design of this virtual system, if you will, from an individual perspective. And then from a population perspective, it's that anonymous, I don't need to be diagnosed with a mental illness or a mental health concern. I can seek support and intervention as part of my recovery, whether I've been diagnosed or whether I haven't. So then Togetherall became that population-based tool and technology to engage people with their recovery with a peer anchor to that. And then when COVID hit, we had an opportunity to implement Togetherall as part of our psychosocial response to COVID. And so that probably happened in 2020-ish. And we've had 20,000 Albertans access the platform in the last couple of years. So again, anonymous, scalable, fairly turnkey, clinically moderated, all of those things became really important to, at a population level, integrating that into our care continuum, into our existing service providers in a really nice way. So it does touch on access for all in spades, Henry.
Excellent. And Phil, I think finish up. So I'll leave it with you, Phil, to take us home.
Henry, I think access for all requires access to the right care at the right time, all the time. It's a tagline we've been working on internally to describe this. For us, this question of access and what it means. And really that breaks down into the things we've been talking about throughout our call here. And that is iterative choice and scalability. So iterative choice, that I can have the option to get the level of support, the level of anonymous global peer support in the Togetherall platform, all the way through to sitting down with a therapist and having that level of choice. It also requires that system to be scalable and reliable. And so those two things combined, I think, are informing our strategy and what it means to then truly create access for all that is the right care at the right time all the time. And so it's iterative choice for the individual and a system that is scalable.
That's a great way to finish. Thank you all for your time. I really appreciate it. And it is a pleasure for us to be working with you all in these different settings. And we're very proud of the work we do with you. So thank you very much. And thanks for your time today. Thank you.